At the present time, emotions are found in tri-brain trauma therapy by checking the emotions within the associated meridians, as the associated emotions for the chakras are in the process of being discovered. Step 11 is where the correction phase is initiated. To treat any possible global psychological reversal, the therapist asks the client to go to the sore spots on the chest or lung meridian 1 and to either rub one or both spots in a clockwise circle, repeating the phrase, "Even though I have this problem, I deeply and profoundly love and accept myself," 3 times. This step is a prophylactic intervention to disarm any energetic reversals that might be present and could sabotage treatment.
I deeply and profoundly love and accept myself, even though I have this problem. I deeply and profoundly love and accept myself, even though I have this problem. I deeply and profoundly love and accept myself, even though I have this problem.
In step 12A, the therapist muscle tests with the statement, the concept that the correction should take place on the chakra system. If the arm weakens, the chakra correction should take place. However, it is important before the correction to ask the body the concept that the correction should take place on the meridian system, which is step 12B. If the arm weakens, a meridian correction is called for. In rare cases, both systems need to be corrected. Many therapists in the energetic community believe that clearing the chakra system results in more permanent change of the client, especially if the issue that is being dealt with is early childhood abuse or trauma. Step 13A is the chakra clearing. The clearing is done in one of 2 ways. The first way is for the client to hold the emotional points on the forehead and the active chakra point and think about the issue while breathing for around a minute or whenever they feel the issue has been resolved. Alternatively, the client can hold the same points and the therapist can place their hands 6 to 8 inches from the chakra point and direct their energy and intention to the area. This is similar to healing touch techniques and is often quite effective. After the intervention, the 14th step is initiated. Step 13B is the meridian clearing. In this step, either the client or the therapist stimulates the meridian so that the toxic energy that has become stuck in the mind-body continuum by the original trauma is released, which results in almost instantaneous emotional and cognitive relief. This relief is also often complete and usually permanent. The client thinks of the original snapshot where the trauma occurred, holds the emotional points on the forehead, and also holds the alarm point. The therapist at this time is directing the client to think about the original issue while they stimulate several points on the spinal processes by firm tapping. They then ask the client to breathe normally as they tap the appropriate spinal processes, then to breathe in fully and hold their breath while they tap the same points. Then the client is asked to breathe out completely and hold and again tap the same points. If the active meridian was lung and the related emotion was grief, then the appropriate spinal processes that would need to be tapped would be T1, T8, and L2. This would be done by the therapist placing their hand over the area of their back and spreading out the first and second fingers and tapping the back of their hand while the client breathes in the 3 previously described ways. The first chart shows the spinal processes and the second chart shows the meridians, the corresponding emotions, and the appropriate spinal processes to stimulate.